choice, where we live, work, learn, play, pray, and heal. We know that these complex issues go deep into communities' infrastructure. So we look for ways to engage community partners and collaborate to address issues impacting our community's heart and diabetes health. We must engage partners, funders, constituents, employees, small businesses, faith-based organizations, schools, and community leaders. 50 million Americans have to choose between paying rent, purchasing medicine, healthy foods, and medical care. 26 million Americans live without access to healthy food. 7.3 million people who suffer from cardiovascular disease are uninsured. Your zip code and race shouldn't determine how you live, but they do. The odds are stacked against low-income communities and communities of colors because of the lack of health food, healthcare, and affordable and safe housing, just to name a few. Examples of these can create decade-long gaps in expected living for people who are just live a few bus stops away. That is why the American Heart Association is also focusing on social determinants of health that have an outcome on our health. We're committed to ensuring all Americans have equal opportunity to make choices that lead to good health. So I wanted just to preference that before we get into the clinical work, because I think it's very important to address. In the chat box, I would love to see if you in your area throughout Indiana can share some of the priority social influencers that are affecting your community, your patients, your neighborhoods. So love to kind of see what external factors are addressing that. And I'll get into some of our work. You know, the American Heart Association has a suite of ambulatory care campaigns. We have our Target BP in partnership with the American Medical Association, our Check Change Control focusing on cholesterol. And we'll talk about our No Diabetes by Heart and the inpatient and outpatient portion of it, Target Type 2 Diabetes. All these programs offer the resources that you see on the slide, and we're very excited to be able to bring that. I mentioned our Target BP with blood pressures with the American Medical Association, and we're very excited that Target Type 2 Diabetes is in partnership with the American Diabetes Association. Next slide, please. You know, when we take a look at organizations for our outpatient campaigns, you could take a look in the slides and really see the number of organizations that have gotten involved and that have taken that next step for registration, for recognition as well. So we're getting more organizations involved, and we're also making a larger impact throughout the United States. I'm very excited to see these, and we continue to have ongoing support and more organizations hopping on board and really choosing one or all of these campaigns. Next slide. So when we take a look at No Diabetes by Heart, we started in 2018. The American Heart Association and the American Diabetes launched a collaborative initiative as the overarching one called No Diabetes by Heart to comprehensively combat the nation's and public health impact of type 2 diabetes and cardiovascular disease. Next slide. And we can see in that next slide the partners that we have throughout the country supporting our efforts and really making sure that we're able to address these issues. The next slide, I want to pause for a second, and we're going to jump into a video. So let me get to that next slide teed up, and then we'll come back in a second.
Among people who have type 2 diabetes, 2 out of 3 of them also have cardiovascular disease. The American Diabetes Association and the American Heart Association have joined forces to develop an initiative called No Diabetes by Heart,
whose aim is to reduce heart attacks, strokes, heart failure, and preventable deaths in persons with type 2 diabetes.
With the help of the ADA, really trying to expand that knowledge base to the larger population at whole. so that people, one, can help treat themselves,
but also to give our providers knowledge so that they can manage both conditions effectively in patients with diabetes.
My name is Ronaldo Linares. I use modern techniques with ancestral flavors. The point here is to create change.
There's a big need for education just on the importance of a healthy lifestyle, exercise, eating healthy.
We're going for nutrient-dense foods here.
So when we're thinking about nutrition education, it's super important for everyone to have a chance to just learn the things to put in their bodies to keep them healthy.
Persons with diabetes need the support of family and friends.
We work together to have a big impact.
You are your best health advocate.
Create multi-generational change now.
If you act today, you can actually impact that course so that you don't have to deal with these issues down the road. Please make sure you look at the information on NoDiabetesByHeart.org.
NoDiabetesByHeart.org.
Thank you very much. So that's just a little video that we've created with our partners at the American Diabetes Association. The American Heart Association is the nation's oldest and largest volunteer organization dedicated to fighting heart disease and stroke. We are able to really work with 40 million volunteers and supporters, and everything that we do really focus on being a relentless force for a world of longer, healthier lives. In addition to this work that we take a look at quality and guidelines, we want to also let people know that there are other portions of how we can make a difference focused on all of our issues related to cardiovascular disease and diabetes. I take a look at policy agendas, I take a look at those strategic alliances. So please keep that in mind. This is one small portion of the No Diabetes by Heart, but we're letting everybody know wherever you feel your area of support can be, there's this place for you to be able to help out. Next slide. People living with type 2 diabetes often have risk factors such as high blood pressure, unhealthy levels of cholesterol, obesity, lack of physical activity, and all contribute to their risk for developing cardiovascular disease. Only about half of the people age 45 or older with type 2 diabetes understand their increased risk for developing cardiovascular disease or have had a chance to talk to their doctor. So we need to really know about that, very important. The longer you live with type 2 diabetes, the higher your cardiovascular disease risk. Every 2 minutes, adults with diabetes in the US are hospitalized for stroke. So once again, a lot of issues for us to continue being aware of. Next slide. When we take a look at No Diabetes by Heart, we'll be reviewing maybe 4 of the key components that we have, whether it's consumer activation, patient support, professional resources, and the quality portions that we'll be talking about today. Next slide. You know, when we take a look at No Diabetes by Heart, it has a rollout and implementation guide for health systems. So we provide that structure and support for you. In that guide, there's information on why this matters and key messages to team leaders. There's guidance on how to engage and develop a campaign plan and how to launch it. And then there's, again, a list of available resources for you and your team. Next slide. We'll be taking a look at downloadable bilingual patient education, so we can you can download that for speed, or we can go ahead and also provide that at no cost. Next slide. We also have healthcare provider resources. So these are developed by both the American Heart Association and the American Diabetes Association guidelines and recommendations. Further research, patient education, community resources can be also found on ADA's website, the Target Type 2 Diabetes website, and also the No Diabetes by Heart. So you can enroll in the campaign, but you could also go to those sites to get more information. We're going to have our next slide to also show a quick little video of what the consumer videos look like. So next slide.
I'm Rob, and I have type 2 diabetes. Thankfully, my doctor helped me make a plan. Now I've been diagnosed with a new purpose, to fight for the amazing life I've made for myself.
Manage the link between diabetes, heart disease, and stroke. NoDiabetesByHeart.org.
Thank you very much. So we're going to get into type 2, and we're going to talk about the campaign. So next slide. So when we take a look at target type 2 diabetes, the goal of that initiative is to raise awareness and understanding of the link between type 2 diabetes and cardiovascular disease, support healthcare providers and educating their patients living with type 2 diabetes and cardiovascular disease, as well as increase patient engagement and prevention of cardiovascular disease by empowering patients to better manage their risk. Next slide. This chart illustrates how, how a variety of lifestyles and hereditary factors contribute to diabetes and how diabetes can worsen or increase the risk of cardiovascular disease. It does not take into account those social determinants of health that I spoke about earlier. Next slide. When we take a look at target type 2 diabetes, and it aims to ensure patients with type 2 diabetes receive the most up-to-date evidence-based care when hospitalized with cardiovascular disease or stroke. To bring attention to this critical high-risk population, AHA has initiated the Target Type 2 Diabetes Honor Roll, a new recognition opportunity for participants of Get With the Guidelines heart failure or Get With the Guidelines stroke. So we all have the inpatient opportunity as well as the outpatient campaign. So let me go for the next slide and kind of share a little bit more. By improving our stroke care, our Get With Guidelines stroke program benefits patients as well as hospitals. Numerous published studies demonstrated the program's success in improving patient outcome. And since the program started in 2003, over 2,000 hospitals have entered more than 5 million patient records with our Get With the Guidelines stroke. When we take a look at heart failure, it's for improving care by promoting consistent adherence to the latest scientific treatments. Numerous publication studies demonstrated the program's success in achieving significant patient outcomes and improvements. So just want to kind of share that as well with running those campaigns. And next slide. When we take a look at enrollment, let me kind of share. We're asking existing hospitals to be able to roll in, whether with stroke or heart failure, some of the diabetes related measures to be able to get into that honor roll. So we want to provide that. We also want to let people know that we'll provide some guidance on a self-site assessment. So we can provide an Excel worksheet. If the hospital only has 1 or 2 champions, there's a tool that can really be helpful in laying out the support for moving out with diabetes. There's a self-assessment tool broken out in 4 categories: team structure, identifying and assessing procedures, management of patient care, and patient education. I'll talk more about the structure in later slides. Next slide. When we take a look at the outpatient one, we also have the opportunity to get recognition for our ambulatory care side of the house. So we have the participant status and the gold status. We'll get into those in a second, but I want you to let people know that with participants, we get a chance to submit data. So you'll able to, everybody's automatically enrolled in that one. And when we take a look at gold, in addition to that, we want to make sure that we're able to provide some control with our patients with hemoglobin A1C levels, and a selection of either a statin therapy or hypertension control. So we'll get into that in a second. I've got another video queued up for you to show some more of the videos that we have for this campaign.
My name is Hyvel. I always knew I was at risk, but I let it slide. I had a stroke and a quadruple heart bypass as complications to my type 2 diabetes. My sister inspired me to take a new step to getting back to a new life. Thanks to her, I've been given a second chance to redefine my health. Now I stay strong for us.
Manage the link between diabetes, heart disease, and stroke. NoDiabetesByHeart.org.
Thank you very much. So when we take a look, I know many organizations have signed up for AHA campaigns, especially Get With the Guidelines. With Target Type 2 Diabetes for ambulatory care, the registration is relatively simple. These are on the screen is kind of what we'll really need to know. Organizations' contact information. We typically ask our organizations to have 1 or 2 leaders and champions to really help us. But the information that we need for enrollment is relatively straightforward, with a little bit of data of patient population as well. When you go ahead and sign up for Target Type 2 Diabetes, you also have the option to enroll in the Target BP and the cholesterol, but obviously you can focus on Target Type 2 Diabetes. Next slide. I also wanted to take an opportunity to really talk about the recognition portion of it as well. And what does that look like when we are looking at registration, for recognition for the campaign. So this is an actual website shot of what the recognition end of the year will look like. These are the pieces of information that you'll need. Obviously, again, total population, the breakdown of race and ethnicities as well, the number of healthcare providers. Next slide. Once again, ongoing informations, protocols, whether if you have a treatment plan. So I'm just making sure easy answers and checking off what your hospital site has. Next slide. Making sure that we're tracking patients for comorbidities, and then making sure that we're committed to addressing cardiovascular risk with people with type 2 diabetes. Next slide. And then this is where we kind of really get into that opportunity. So you'll have the numerators and denominators to be able to put in of your total population and those who've been diagnosed with diabetes, and also sharing the hemoglobin A1C levels. So this will be one of the things we have to be able to go for recognition. On the next slide, we'll go ahead and show the two other options you'll have to do. So if you want to take a look at statin therapy, these will be the numbers we'll be able to select from. So it's the diabetes for sure, and then you'll be able to select from the statin therapy numbers, or the next slide, of the hypertension blood pressure number. So depending on your sites, some sites have been really focusing on hypertension control. We've seen a lot of that connection with diabetes. They'll usually select this one, and obviously the mandatory diabetes one, but just to show you what we need. So essentially we're asking about 14 questions to be able to get for recognition. Very important for us, relatively straightforward, and most of our champions could really knock this out within half an hour, if not less. Next slide. So when we take a look at the diabetes and CVD team roster, we're engaging these individuals to ensure that we'll have a comprehensive awareness and alignments amongst clinical care teams and support teams for a successful rollout of the initiatives. Determine which departments need to review or approve the initiative implementation plan prior to the launch. These may include, but aren't limited to, our medical and legal, patient education and advocacy, marketing, communication, IT. This cross-functional type 2 diabetes management team suggests rosters is meant to be suggested outline for hospital champions and specialists who are recommended members of the diabetes team care as recommended by the American Diabetes Association. So I just want to kind of share that as well.
5 minutes, Phil.
Got it. And we're down to our last few slides. Let me show my final slide with somebody we may also know. So let me kind of go onto that slide, and we'll share her as our national spokesperson.
You've been diagnosed with type 2 diabetes and an increased risk of developing heart disease.
Take 2.
Action. You've been diagnosed with a new purpose, to look at that risk of heart disease and say, no, not me. NoDiabetesByHeart.org.
Thank you very much. Obviously showing Angela Bassett at that one as a longtime spokesperson for the ADA, and now joining our No Diabetes by Heart. I've actually, before I spent some time at American Heart, I started my national health career at the ADA Northern Illinois. So very happy to see us partnering together. Wanted to provide some links for you for No Diabetes by Heart, getting deeper into the target type 2 diabetes opportunity. And we have some links that'll be provided for you in a PDF at a later opportunity. Next slide. For those of us who are also interested in social media channels, we recommend everybody to take a look at the latest information. We have our lay audience and our professional links for AHA, ADA available for you as well. So take a look at these opportunities to join us on social media to find out patient stories, to maybe potentially get you and your clinic also features as well. Next slide. And finally, go to the website, NoDiabetesByHeart.org for more information. Again, that is a larger campaign with the target type 2 diabetes, whether it's inpatient or the outpatient campaign. So really help us help you really make an impact on our communities and your patient population. Thank you very much. Looking forward to questions and answers in after these presentations.